Well, the Center for African American Health has been a powerful resource in the community for 25 years. And with COVID still affecting many lives, well, their mission is more important than ever. Deidre Johnson, CEO and Executive Director, and Dr. Oswaldo Granardo, board member for the center and also medical director for Centura's Colorado Health Neighborhoods, chat with us this morning. 25 years, that is a big celebration. I'm going to first start off with talking to you, Deidre. Why was the Center for African American Health first established 25 years ago?
You know, when we were established, we were called the Metro Denver Black Church Initiative, and we were partnering with faith communities to do everything from after school care, education, health, as well as working with families of incarcerated parents. So through the years, we really came in to narrow in on health. And that's because our community suffers from historic health disparities, whether we're looking at maternal and infant mortality, diabetes, heart disease, you name it. We tend to experience excess death across the board. And so our goal really is to help people live as healthy as possible, but we also work to try to help systems improve and do better by our population.
Of course, and the work that you do is tremendous here. Now, as the time has gone by, what have you found is that one resource or resources that have really been utilized a lot by the community?
You know, one resource that's been consistent and timeless throughout our time in existence has been navigation. Anyone can come to us, and while we may not have a particular class or program or service, we always help navigate them to where they need to go to get the services that they need. So really having that support for folks as they figure out how to get the services and supports they need to be healthy.
Sure. Now, Dr. Oz is with us this morning as well. Dr. Oz, I have a question for you regarding COVID. Now, since it began, the center established itself as a resource for vaccinations and really helping people out there. What are you seeing as some health-related trends within the African American community, Doctor?
Yeah, the biggest one that we've seen since COVID began is really the decrease in life expectancy for the Black community. So Black men have lost 3 years of life expectancy in the last year, as well as Black women have lost 2.4 years of life expectancy. That's terrible. And that really relates to some of the social determinants of health that were really brought out that negatively affected our health outcomes.
Well, and speaking of COVID, Deidre, back to you. We've seen a spike in those cases. I mean, they have surged like crazy. Let's talk about how that's impacted the African American community. Now, I know there's been some questions or hesitancy when it comes to the vaccine and the booster. Why is that?
You know, it really has its roots in history. Now, to be honest, when I started really focusing in on this when the pandemic first started, no community has a great vaccination record. In fact, the highest even among white Americans has always been like 60%. So there's always been a challenge. But when it comes to our community vaccinations, there's a long history of distrust of the medical system. And, you know, we've got those examples like Henrietta Lacks, the Tuskegee experiment, and really several foundational experiments throughout history that help build up certain medical practices. And not only is that something we try to dispel, but we really are trying to educate people. Here's what it is, here's what it isn't. Let people know that there were actually African American doctors involved in the creation of the vaccinations. And what's been really helpful, and I have a huge thank you to Dr. Granardo and other doctors who work with us, having community members being able to ask doctors their questions and concerns and just constantly try to get over that hesitancy.
Back to you, Dr. Oz. Say someone in your household has tested positive. How on earth do you stay healthy living within close quarters? I mean, it's happened even in my house with my kids.
Yeah, it's difficult. We want to make sure that those who have tested positive are trying to stay away as much as possible from other family members if they can. When you're in close quarters, that may or may not be able to happen. We'd like for the other people in the house who have not been tested positive to wear certainly a mask when they can. Is it awkward to wear a mask in your own house? Yes, but when you are dealing with trying to prevent yourself from actually getting the virus, that's one of the best ways that we can do actually prevent it. So it's making sure that you're trying to stay away, social distance, making sure that you're wearing a mask, but then also making sure that you've gotten your boosters for your vaccine or your first vaccine, if not. That is really key to making sure that you're doing as much as you can to at least help yourself try not to get infected with this new variant.
Got it. Well, thank you so much to the both of you for being with us today. Congrats on 25 years of doing great work. And I'm going to give everyone more information on the Center for African American Health.
Yes, great work. The Center for African American Health will be doing health screenings and so much more to celebrate those 25 years. So get the website and stay tuned for updates, CAAHealth.org, or you can call them at 303-355-3423.